Welcome. We would like to welcome you to Francis Mahon Deaconess Hospital. It is our privilege and honor to be caring for you while you are here. If you have any needs, concerns, or questions, please do not hesitate to talk with any of the staff caring for you. I would like to take a moment to talk to you about a few things. Be involved in your care. We encourage you to be an active part of your healthcare team. Speak up if you have any questions or concerns about your care, condition, or treatment plan or options. Pay attention to the care you get. Educate yourself about your illness. Ask a trusted family member or friend to be your advocate, advisor, or supporter. Know your medications you take and why you take them. Patient rights. You have the right to be informed about your rights as a patient. You have the right to courteous and respectful treatment. You have the right to have your questions answered. You have the right to know about your diagnosis and treatment. You have the right to be involved in planning your care. You have the right to know your doctor's name. You have the right to be free from mental or physical abuse. You have the right to exercise your rights through complaints and grievances. You have the right to respect of your individuality or differences. You have the right to privacy. You have the right to speak, privately with family or friends. You have the right to request that information regarding your identity be kept confidential. You have the right to your pain treated. Your responsibilities as a patient. To follow hospital rules, be courteous and respectful to the staff and other patients, and to be understanding when faced with reasonable and necessary delays. To make your needs known clearly and to ask if you do not understand your medical problems, treatment, or care, including when you will be seen again by a provider. To ask questions about what you sign so that you can make informed decisions, and to ask not only the name of your healthcare worker, but how each person is involved in your care. To let us know of your dissatisfaction. About your hospital room. All our hospital beds have controls to move the head and foot of the bed. The controls are located on both the left and right bedside rails. Telephones are located in all patient rooms. For local calls, dial 9, then the number desired. Long-distance calls can be made using a calling card. Incoming calls are directed through the switchboard. You may make a request from your nurse that calls are not sent to your room to allow for privacy or rest. Each room has a handheld call light control next to the bed. Push the big red button for assistance and a nurse or CNA will come to check on you. Push the power button to turn on the television and push the blue arrow buttons to change the channel or volume of the TV. Push the yellow light bulb to control the light above your bed. Each patient room has an adjoining bathroom. If assistance is needed while in the bathroom, there is a string to pull next to the toilet and in the shower to notify help. Do not hesitate to call for help. Visiting hours are from 6 a.m. to 9 p.m. We recognize that some people may need to visit outside of these hours. Visitors can make arrangements with the patient's nurse to accommodate this. If you, your family, physician, or nurse feel it is best for you, visitors may be restricted. ID patients correctly. For your safety, you may be asked your name and birth date several times in one day by the same care provider. Please be patient with them. They are working to ensure safe medication administration for you and ensure the correct procedures or treatments are being given to you as well. To ensure a patient gets the right blood for a transfusion, it is our practice 2 people check your identity with the blood being given. Every detail must match exactly for a blood product to be given safely to you. Medications. Upon admission, every patient is asked for a list of current medications, including herbals and over-the-counter products. This list is used to reconcile the medications taken at home with the medications ordered in the hospital. All medications you receive while at Francis Mahon Deaconess Hospital are dispensed from the hospital pharmacy. Before you are discharged home, you will be given a list of medication to take at home with an explanation of the purpose of each medication. The list of medications you are sent home on will be shared with your personal care provider in the Glasgow Clinic to ensure continuity. If your personal care provider works outside of the Glasgow Clinic, we encourage you to take your discharge medication list with you to your follow-up appointment. Preventing the spread of infection. For everyone's safety, staff and patients should use good hand washing technique. When washing hands with soap and water, wet your hands with clean, running water and apply soap. Use warm water if it is available. Rub hands together to make lather and scrub all surfaces. Continue rubbing hands for 20 seconds. Need a timer? Sing happy birthday twice through. Rinse hands well under running water. Dry your hands using a paper towel or air dryer. If possible, use your paper towel to turn off the faucet. When using an alcohol-based hand sanitizer, apply product to the palm of one hand, rub hands together, rub the product all over surfaces of hands and fingers until hands are dry. We ask that family and friends do not sit on your bed or use your bathroom so germs are not spread either to you or from you to themselves and everyone they later come in contact with. Some infections are very difficult to treat. As a result, special guidelines are in place to prevent such infections from occurring or spreading. FMDH continually updates standards of practice to prevent infections, to promote safety, and meet national expectations for care. Preventing a fall. As part of your admission assessment, staff will determine if your health, medications, or other factors place you at risk of falling. If you are at risk, our staff will work with you and your family to develop a plan to prevent you from falling. Things you can do to prevent a fall include: use the call light for assistance before getting out of bed or off the toilet if you are at risk for falling. Tell your nurse if you are dizzy, weak, or lightheaded. Wear non-skid socks or slippers when you are out of bed. Sit at the side of a bed for a few minutes before standing. Do not get up quickly. Use your walker or cane as instructed. Use grab bars in the bathroom and in the hallways. Do not grab onto movable objects such as IV poles, recliners, or items with wheels, as they are not stable and can move easily, allowing you to fall. Safety risks. If you are ever concerned about your own safety, report your concerns to your nurse or doctor. If you have any concerns that another patient or even you could be a danger to themselves or others, please tell a nurse or doctor. Everyone should feel safe and comfortable. If there is anything that you believe is a hazard, are concerned about, or feel would facilitate your recovery process, please report it to your nurse or doctor. Changes in your condition. We have created a team of nurses who will be alerted and respond to care for you if you or your family member have immediate or urgent concerns about a life-threatening change in your condition. To activate the team, dial 3222 and ask for the Rapid Response Team. Bedside Shift Report. At FMDH, we conduct Bedside Report to keep you better informed about your plan of care, medications, tests, and progress while you are here. This involves the nurses doing bedside reporting in your presence at each shift change to ensure proper communication of all important information and to introduce you to your new nurse. In the event that you have visitors in your room at the time of bedside report or any time you feel uncomfortable about any of the information being discussed, please let your nurse know and other arrangements will be made at that time. If you are sleeping at change of shift report, a nurse will check on you, but the verbal report will be done elsewhere to permit your continued rest, unless you have asked us to wake you up for the report. We know that bedside report will benefit you, the patient, by keeping you better informed of your condition. It also allows us to continue to maintain the high quality of care that you expect as a patient at Francis Mahon Deaconess Hospital. Hourly rounding. We are committed to providing exceptional care at FMDH, so we round on patients hourly to ensure their safety and to be responsive to their needs. Nursing staff will round on you every hour between the hours of 6 a.m. and 10 p.m. and every 2 hours between the hours of 10 p.m. and 6 a.m. unless you are sleeping. If there is a time frame when you would prefer we don't round on you hourly, please let us know so that we can respect your wishes. Multidisciplinary care rounds. Because our goal is to have a patient-centered approach here at FMDH, we want you to be a part of our multidisciplinary patient care rounds. A team may come around to visit you between 10 and 11 a.m. Monday through Friday. This team consists of the hospitalist, your nurse, the dietitian, discharge planner, pharmacist, infection control, and the respiratory therapist. You are important to us, and we want to make sure that your comments and concerns are addressed. At these rounds, your care and progress will be talked about, so please feel free to be part of the discussion. We want to make sure that you will be ready for discharge when the time comes. Observation status. If you are placed on observation status, this is a short-term stay, usually less than 24 hours, where a patient's condition can be monitored. If it is determined that the diagnosis is an acute illness or requires surgery and a longer stay is necessary, the patient will be transferred to inpatient status. If you are on Medicare and are given medications that Medicare believes you could take on your own, Medicare may not pay for them while you are in the hospital. This means you will have to file these medications with your own Medicare D plan. If you need assistance in doing this, please ask to have the financial counselor come visit with you while you are in the hospital. Thank you. Thank you for choosing to be taken care of at FMDH. We are honored to serve you. Please let any of our staff members know if you have any needs, questions, or concerns.